need would be Senator Rubio for file item number 8. You may begin.
Well, good afternoon, Madam Chair and members. I am pleased to present AB 2531 today. In December of last year, the Trump administration finalized a rule to prohibit the Veterans Health Administration, known as the VA, from providing abortion care. The potential effects of this decision are profound. Veterans in California who have worn the uniform and put their lives on the line are now being denied basic reproductive health care from the VA because the Trump administration's discriminatory policies toward women. Throughout my tenure in the legislature, I've always maintained a steadfast commitment to our veterans, whether it was through my time as chair of Military and Veterans of the Military and Veterans Affairs Committee, or through the legislation I ran to place Proposition 1 on the 2024 ballot. It has always been a priority to ensure that we take care of the people who served our country. And taking care of our veterans is exactly what this bill does. AB 2531 puts our veterans first where the federal government has failed them. It narrowly expands access to our existing uncompensated care grant program so that it will include veterans whose federal health care coverage no longer includes abortion services. This will ensure that veterans who cannot receive abortion care or abortion counseling through the VA system are not left behind. The bill also requires the California Department of Veteran Affairs to include a link to the abortion.ca.gov in their existing list of resources for veterans to ensure that our veterans know they have access to this critical care coverage. With me to testify in support of the bill today is Angela Pontes from Planned Parenthood.
Thank you. You will have a total of 5 minutes for your presentation.
Thank you, Chair and members. Angela Pontes on behalf of Planned Parenthood Affiliates of California. We are a proud sponsor of AB 2531. In 2022, following the Dobbs decision, Senator Weber Pearson had the foresight to author AB 2134, which created the uncompensated care program to ensure abortion and contraception would be accessible to Californians and to support the safety net providers offering such care. AB 2531 narrowly expands this existing program to include veterans in the eligibility in response to recent federal action, as stated, that severely restricts access to abortion care through the federal VA system. Under this new policy, the VA can only provide abortion in life-threatening circumstances. This is an intentionally high threshold that has dangerous and cruel consequences. Despite California's constitutional protections for reproductive freedom, our state's veterans and VA providers cannot obtain or provide abortion care or even abortion counseling. Without this bill, veterans may only access abortion care if they have the means to identify a non-VA provider and pay out of pocket. AB 2531 addresses a significant inequity for a small population in a simple way. We ask for your aye vote on AB 2531.
Thank you. If there's anyone else in the audience that would like to register their support for this bill, please come to the microphone, state your name, your organization, and your position.
Aubrey Rodriguez with ACLU California Action and proud support.
Thank you.
Andrea Mavisco on behalf of CPCA Advocates in support.
Thank you.
Martin Radosevich on behalf of Reproductive Freedom for All California in support.
Thank you.
Good afternoon. Henry Reinen on behalf of Lieutenant Governor Eleni Kounalakis in support.
Thank you.
Ryan Spencer on behalf of the American College of OBGYNs District 9 in support.
Thank you.
Kevin Guzman with the California Medical Association in support.
Thank you. All right, seeing no further individuals wanting to register their support, if there's anyone who would like to speak and lead opposition to this bill, this is your time to come forward. Thank you. You will have a total of 5 minutes.
Thank you, Chair and members. My name is Leandra Wells with the California Family Council, AB 2531 is framed as caring for veterans, but true care means providing support that addresses the need for both mothers and children, not using taxpayer dollars to expand abortion funding. This proposal claims veterans are being denied health care, but abortion ends a human life, and murder is not health care. Look at what our veterans actually face. According to HUD and the VA, on a single night this past January, 32,495 veterans were homeless. They are still waiting on housing, on mental health treatment, on help with their disability claims. This is the unmet need. Yet just this February, the state sent $90 million to Planned Parenthood and other abortion providers, and AB 2531 now asks us to spend more? If we truly want to honor those who served, our priority should be meeting those urgent needs, not writing larger checks to abortion providers. Our veterans carry some of the highest rates of PTSD, depression, and suicide in the nation. Many already live with deep trauma. Even the American Psychological Association acknowledges that some women experience clinically significant depression and anxiety after an abortion. For veterans already hurting, this is not a risk the state should be funding. Nothing in this bill requires that a veteran be told about adoption, pregnancy resource centers, parenting assistance, or other life-affirming options. It points to one path and excludes alternatives that many women would choose if they knew the help was available to them. Our veterans deserve better than taxpayer-funded abortion and one-sided information. They deserve real support, real resources, and real hope. Abortion does not heal trauma. It adds to it. Give our veterans real care, not state-funded murder. Vote no on AB 2531. Thank you.
Thank you. If there's anyone else in the audience that would like to register their opposition, this is your time to come forward, state your name, your organization, and your position. Seeing none, we'll bring it back to committee members to see if they... Senator Menjivar.
I felt compelled as the only veteran on this committee to respond to those comments. I'm a recipient of the VA. That's the only health insurance I've had for the past 15 years. I can tell you there are a lot of services for veterans. The VA I go to specifically has a section for women veterans, and they do baby showers every single month for pregnant female veterans to provide them with anything they need for to become a new mother. They have group counseling for women if they're pregnant. They cover fertility services, 6 rounds of IUI if they want to become pregnant. There's a lot of services that exist for female veterans in the reproductive care, but now because of this federal government, one option is being taken away from them. So while the VA is providing all other options, your bill steps in and provides that extra option that isn't allowed right now. So I want to thank you for that additional support.
Well, I want to thank you so much, Assemblymember Irwin, for recognizing this issue and stepping in to fill that gap. Really want to thank my colleague, Senator Menjivar, for giving an accurate assessment of what the VA already covers in terms of reproductive health options and support and services, and recognizing that this is one very critical service that they are not providing, but it is allowed here in the state of California as a reproductive health state. Just one further point I want to clarify is that this is not providing any extra funding. The funding is already there. We are just expanding who is eligible for the funding because of what this federal government has done. And with that, I will allow you to close.
Just respectfully ask for your aye vote.
Thank you. Would entertain a motion at this time? Moved by Senator Caballero. Motion is do pass and re-refer to the Committee on Military and Veteran Affairs. Assistant, please call the roll.
Senators Weber Pearson.
Aye.
Weber Pearson, aye. Valladares. Caballero. Aye. Caballero, aye. Durazo. Aye. Durazo, aye. Gonzalez. Aye. Gonzalez, aye. Grove. Menjivar. Aye. Menjivar, aye. Padilla. Perez. Aye. Perez, aye. Rubio. Smallwood Cuevas. Aye. Smallwood Cuevas, aye. 7-0 on call.
7-0, we'll place that on call. Thank you. And while we wait for Senator